Hello, my name is Natalia, and I am a senior paediatric nurse with about 14 years of experience. I started off my nursing journey on a general paediatric ward, where I was for about 5 years before moving to paediatric A&E. I spent 2 years there, and then I moved into the community where I was a community nurse seeing children in their homes. I then went on to do a specialist role in transition for children with SEND. And then I was a team lead for the Children's Community Nursing team. And now I am a practice development facilitator in the community. So at the time before becoming a nurse, my nephew was born and he was premature and he was in the NICU. And I used to go and visit him daily. And I really enjoyed watching the nurses and I was really inspired by how they were looking after him. And at the time, I was a nursery nurse. And so I was like, I can come and do this. I can, come and be a nursery nurse in the hospital. And I remember my mum said to me, why would you want to be a nursery nurse when you can be a nurse? And it never dawned on me before. And I was like, okay, I'm going to think about it. I'm going to look at some universities. I'm going to start, looking into what being a nurse is like. And I think ever since then, I was literally just hooked. And for me, I felt like I didn't fall into nursing, but it didn't automatically come to me. I wasn't a child who always knew that she wanted to be a nurse. I wasn't given a nurse's kit. I, just felt like this was my calling once my nephew was born. And so I think I found myself really wanting to make sure that I was the best nurse that I could be, so that I could prove that I didn't fall into nursing, that actually I somehow was called into it at some point in my life. And caring for children and young people while they're unwell is a privilege, it's an honor. And it really, really, just makes me happy to be able to be there for them at sometimes one of the worst times in their lives, but I'm able to help them. I'm able to comfort them. I'm able to support them and their family through that time, and hopefully, through their journey of healing. And so, yeah, that really kind of fulfills me, gives me fulfillment with being a nurse. So there was a patient that I met when I was about 6 months in post-qualified, and he and I really started our journey together, because he got a diagnosis at that time, and I was quite junior as a nurse at that time. And I felt like he taught me so much, and I remember when the last time he came into hospital, I was at that time working in A&E, and the hospital that I worked at, we were really like a family. So I would always go to the different departments and say hello, and just make sure they didn't need any help. Because I was in charge of A&E on that particular shift. And when I went up to the ward, I realized he was there. And so I said to the nurses, if mum needs me at any point, then just ring down and let me know. And I remember I was triaging a patient, and then when I came out of triage, my manager said to me, you need to go up to the ward. And by the time I had gotten to the ward, the patient had sadly passed away. But I was able to stay with mum, and we were able to talk about really fond memories that we had of the young child. And I gave her the time that she needed me to be there, so that she could cry, so that we could talk, and so that she could say goodbye. And then once she left, I prepared him, and then we took him down, and then I phoned mum and let him know that he was okay. And to be honest, there's nothing that calls you to go above and beyond. It's within you. Like, you will want to do everything you can for these children and their families, everything that's within your power to do to make that point of time that little bit more better, that little bit more comfortable, that little bit more bearable. And yeah, that was that situation for me. And for me, I needed to just be there, to be whatever she needed me to be at that point in time. It does. It does take an emotional toll. And I mean, I don't know any nurse that would say that they don't become emotionally involved with patients, because we become such a big part of their lives, especially if it's a patient with a long-term condition. They are seeing us for their whole pediatric journey until, they get transferred to adult services. And so we do become a really constant part of their life so long as we are in that job or in that position. And so it does take an emotional toll. And I remember I cried. I took some time to just think. I thought about the fond memories that I had of him. But also I was grateful, of how much he taught me. Like, I met him when I was a new nurse, and by the time he had passed away, I was a senior nurse. So it was quite a long journey that we had together, but I learned so much from him. And so it felt like I could give him something back. I could give his family something back. And yeah, it does. It does take an emotional toll. And I feel like it's really important to debrief afterwards. It's really important to kind of talk through what you might be feeling. Um, so that, because, I feel we have to be just enough emotional, if that makes sense, because we can't be so emotional that we take away from what the parents are feeling. But then parents don't want to see us like robots, like we don't care, we don't understand what they're feeling. I feel like there's a part of them that wants to know that we understand how they're feeling. They want to know that we are there with them. We're not just there kind of as robots standing and not having any emotion. And when they come and they hug you, you have to be able to understand and relate to them. So high stress situations. I was a nurse, a senior nurse in pediatric A&E for 2 years, and I was in one of the busiest A&Es in London. And I remember one night I had about 60 patients in my department with their parents. And to be honest, in that situation, it's really difficult to be able to stay calm, because you want to make sure that every patient remains safe. And some parents are agitated, they're tired of waiting, children are tired, they're hungry, etc. But I think for me, I just am able, I learned the skill of how to speak to parents calmly, understand where they're coming from. If I can help them, I will always help. And just being able to basically look around the room, like read the room, make sure every child is still safe, every child is still breathing, children are getting their medication as much as possible. And it's about being able to prioritize. So sometimes a patient will come in a lot later than other patients, but they take priority because they're sicker. And it's just about being able to say, okay, I need to prioritize this patient, but explaining that to parents as well. And yeah, using your initiative. Like, sometimes you have to think outside of the box in order to remain calm, in order to move things forward, in order to make sure that everybody is seen in a timely fashion. For me, I think I definitely learned how to work well under pressure on the job. Like, because I think for me, like when I was a student, I got a certain amount of patients, not many, but just the enough that you can handle, you can manage. But when you become a qualified nurse, the doors are then open. And so sometimes you have no idea, especially in A&E, you have no idea who's coming in, you have no idea what time they're coming in, you have no idea what's coming in. And so you've always got to be on your feet, you've always got to be able to think on your feet, you've got to be able to move quickly. Sometimes you've got to move a patient out of a room to move another patient into a room. And so for me, it's something definitely that you learn on the job, and it comes with experience. And it can be passed down. And for me, one of the things that I always did when I was in A&E was to put my junior staff in charge, just because it means that if ever there was a time when there wasn't a senior staff on shift, the junior staff would be able to manage. They would know what they needed to do and what they needed to prioritize in order to keep everybody safe. So I think that a nurse needs to be patient. They need to be humble. They need to be empathetic. They need to be understanding. They need to be loving and caring. They need to be fun. They need to be good listeners. They need to be able to use their initiative. There's so many qualities that comes with being a nurse, and I think that it really depends on the role that you're in terms of being a nurse, because sometimes depending on your role, you may need to have a little bit more of something. So say, for example, in A&E, I had to develop patients because I wasn't in control at that time. Like, I would see a patient, but then they'll need to be seen by a doctor, and then I'll need to provide treatment. And if everything wasn't running on time and the way it should be, I'd have to wait. And so, yeah, I think that the role that you do as a nurse depends on the skills that you have as a nurse sometimes can depend on the role that you're doing as a nurse. And for me, because I've had such a rich nursing experience so far, I've been able to learn so many skills, and some of the skills that I didn't have before, I'm developing. And now in my PDF role, I mean, you always do teach anyway. Nurses are always teachers. And learners, actually, because I've had so many situations where I've had to learn from parents, which is amazing. Like, the parents were the professionals and I was the student, so to say. But now I'm going to actually be in a teaching role. So now I'm going to be developing my teaching skills more than I would have done before. So I had a patient who had been admitted to hospital, and I was very much in touch with this parent quite often, and the parent called me because they weren't happy with the care that they were receiving at the hospital. The doctors weren't really listening to the parent, and so I decided that I would go down and review the patient and see, like, what the problem was. And when I got there, I completely understood what mum was saying. The patient wasn't well, and the mode of treatment that they were giving him, in my opinion, wasn't correct. And so I had asked the consultant to review the patient, and she wasn't very familiar with the patient. And so she felt that his condition was normal, which I said wasn't normal. And so I requested for his mode of treatment to be changed, which they agreed with. And mum ended up feeling very happy with what was happening afterwards. And for me, we have to realize that parents are the first carer of a child. And it's really important to listen to them. Even if we don't agree, we can have a conversation, but we shouldn't go against them, in the sense of, if they have a concern, we should really be willing to listen and maybe willing to negotiate. So at this time, this parent felt really powerless, and I felt like I needed to go and advocate for my patient and for her. And when I got there, I was really happy that I did go, because it wasn't the right method of treatment for this particular patient. So sometimes it can be really hard to build trust with parents, especially when they're going through a difficult situation. What I tend to do is ring them first. If they're not familiar with who I am, then I ring them first, I introduce myself. I let them know, that I'm going to come and visit them at home and why I'm coming. And I take all the information that I need with me, if possible. And I'm really open and honest. So if they ask me a question and I don't know the answer, I will say to them, I'm really sorry, I don't know, but I will try my best to find it out. And I think that building trust is really about, it's a two-way street, if that makes sense. And, I feel like they expect honesty from me, and that's what I give them. I give them my time. I let them know that they can contact me, the different modes that they can contact me, and just that I'm there if they have any questions. I know that sometimes there's so many professionals involved, and so I do as much as they need me to do. But I also say to them, look, this is what you can do, this is what I can do. You tell me what you want to do. So if they want to do more than I need them to do, then they're needed to do, then that's absolutely fine. I will work with them, I will train them and teach them if they need to do. So if there's a procedure that the child needs and they want to know how to do it themselves, then I will train them to do that. And if they really don't want to do it, then I won't put that on them. But I feel like it's important to really just develop an individual relationship. And I'm a mother myself, and I feel like after having children, I became a better nurse because I was able to see children through a parent's eyes, like understand what they may be going through and understand what they may need. So say, for example, like when I used to work on the ward and we have babies on the ward overnight that may need feeding, I would say to parents, okay, do you want me to feed or do you want to feed? Do you want me to wake you up to ask you if you want to feed, or do you want to just decide, or do you want to take it each day as it goes? Because sometimes parents come in and they're really tired because they've already had a sick baby and they're really tired and they don't want to feel like they're neglecting their baby to say no, but they want to be asked, if that makes sense. So I always ask them, what is it that you want me to do? And I find that helps in building a trusting relationship, because I'm not just there about the baby, I'm there about them as well. And I take a holistic response. I take a holistic approach to the care that I give the children and families under my care. So I had a patient who had been discharged from hospital, who had been in hospital for quite a little while and then was discharged, and I wasn't informed, and their plan of care had changed. And I got to find out about this from the parent who rang me, who said, when is this going to be done? And I was like, I don't even know what you're talking about. I haven't received a discharge summary. And I was annoyed, if I'm allowed to say that, because I really try and give my patients the best possible care. And if I'm not informed of the care that they need, if I'm not informed that they're no longer in hospital, then that really affects the care that I'm able to deliver to them. And so I emailed all the consultants, all the nurses that were involved in this patient's care, and I arranged a meeting, which I chaired. And I really was able to get a plan in place for this young person. So therefore, whenever they were admitted to hospital, then the specialist nurse would let me know that they had been admitted. And then that meant that I could choose whether I was going to contact them by phone or if I was going to visit them in hospital, because it also means that I'm able to support a quicker discharge, a quicker and a safer discharge. But I can't do that if I'm not aware of what the plan is for them. And so having a meeting with all the professionals involved and parents as well, actually, just meant that everyone was on the same page. We were all able to understand what the plan of care was for this patient. And it meant that we were more concise in communicating with each other and also in carrying out the care that this young person needed. So if I be honest, I feel like it's really difficult at times to make sure that you are keeping up to date, especially when we are social of nurses and social on time. To be able to sit down and actually just say, okay, I'm going to focus on this now is really difficult. However, what I try and do is make sure that I keep up to date with my online learning within my trust. And I'm always scoping out activities to do and outside courses. So I'm going to be attending a course next week, which is about oncology, and that will update me around caring for children with oncology. And I subscribe to one of the nursing magazines, so I I keep up to date using that one as well. I think that providing holistic care for children and young people is really, really important, especially with the rise in mental health issues. For me, I go with an open mind. I'm not, what's the word? I go with an open mind. I'm not task orientated. So although I may be going to do a task when I go and see a patient, I'm always asking them how they're doing, asking them how is school, checking if they're drinking enough, because I feel like when you open up a conversation, you then may find out things that they didn't even think to tell you. And the care of the patient is really about the whole patient. It's not just about what is wrong with them in that particular time or moment. It's about the whole of them and their family as well. And so I can give an example where I went to go and see a patient. It was a baby, and the mum was quite overwhelmed with caring for the children. And I said to her, just take a minute. And I looked after the children, put them to sleep, and mum just had a minute to catch her breath. And for me, it really meant that I left her in a state where she could look after her children, not that she was feeling just completely at wit's end. And for me, it's really important because these children rely on us for one bit of care, but they rely on their parents for everything else. And so we have to make sure that the whole family is good, that, the whole household, that whole unit, family unit is okay and they're doing okay. And if not, what we can do to support them to get help if anything, in order to be okay. Because we can't go in and just see just that patient or just that need when there's a whole need. If a child is diagnosed with a long-term condition, that affects the whole family, that affects their daily living. That may affect how they eat their food and what time they eat their food, and being able to go to work or being able to pick up the children or being able to go shopping. It just affects their whole life. And so I feel like for me, providing holistic care takes into account the child, but their whole family unit, and making sure that everybody is doing okay. For me, the most fulfilling aspect of being a nurse is just being able to be myself with children, just being able to care for them, look after them, make them smile, do colouring with them, play cards with them. Um, just just being there, because if a child needs a nurse, it means they're unwell, and it means that they're going through a rough time, and forever how long that might be, it means that I can help to make that journey. It means that I can help to make that day, that hour, just a little bit better. I remember when I was on a ward, I had a patient who was quite upset. She was a teenager. And because of the injuries she sustained, she couldn't get out of bed. And I remember that she was upset because her hair was dirty. She wanted to wash her hair. And I decided to just get a bowl, get some stuff to wash her hair, take the take the bed head off the bed and wash her hair. And she didn't feel like it could be done, if that makes sense. And just being able to do what they need, just for me, is the essence of being a nurse. Washing her hair was nothing to do with my job at that time, but it was what she needed, and I was more than happy to give it to her. So for me, I like to just be whatever they need me to be at the time that they need it. If I can share another story with you, I had an oncology patient who she had had all of the pain relief that she could, and she was just still in so much pain. And I remember just sitting with her for hours on one night shift, just rubbing her legs, because that's where the pain was. And I rubbed them until she fell asleep. And then I went and saw my other patients and then came back just so I was there when she woke up and if she needed me. And for me, that's the essence of being a nurse. That's the essence of what we do is just being there to give our patients what they need from us. It may not be medication, it may be someone to talk to, it may be someone to rub your legs, it may be someone to wash your hair, it may be someone to play cards with, but you're just there for that time where they are going through a hard time and you're there to make it better.